Hello everyone and welcome to our webinar today, Employment Pathways for People with a Disability, Lessons Learned from the United States. My name is Jenny Crosbie and I'm from the Centre for Social Impact at Swinburne, and I'll be your host today. Before we start, I would like to acknowledge the traditional owners of the land we are gathering on today. On behalf of those present, I would like to acknowledge the Wurundjeri people of the Kulin Nation, who are the traditional custodians of the land on which we now meet. I pay my respects to their elders, past and present. I'd also like to acknowledge elders from other parts of the country where we're meeting today. I also pay my respects to all Aboriginal and Torres Strait Islander people of Australia and hope that the path towards reconciliation continues to be shared and embraced. This webinar today has been developed in response to a body of work that we are carrying out at the Centre for Social Impact with the disability sector, and as part of the information, linkages and capacity building project called Connecting Pathways to Employment with the Work Integration Social Enterprise Model. We've received so much great support for this project, which was funded by the Information Linkages and Capacity Building Initiative. So I'd like to say a big thanks to to Gen U for their support, one of our main partners, as well as Fighting Chance, who run the Jigsaw program, Ability Works and Wise Clean Force. I'd also like to introduce and thank our keynote speakers today, Rich Luecking and Sara Murphy, for participating in today's webinar. Sara Murphy is the Director of WorkLink, Transcend's San Francisco-based employment program for job seekers with disabilities. Rich Luecking is a consultant and subject matter expert on competitive integrated employment, school-to-work transition, and related community inclusion initiatives for individuals with disabilities. Rich was also previously the president of Transcend Inc. Just briefly outlining our agenda for today. So the aim of this webinar is to look at the challenges and possibilities for disability employment pathways in Australia and the US. First up, Professor Erin Wilson and Dr. Perry Campbell from CSI Swinburne will provide an overview of the work we've been doing at the Centre for Social Impact. Then we will hear from Sara Murphy and Rich Luecking about the US policy context shaping employment pathways for people with a disability and key shifts in disability employment practice on the ground in the United States. Sara will also discuss challenges ahead and changes that are still needed. At the end of the webinar, we'll have a Q&A session, so please put your questions into the chat box and we will monitor these as we go. We'll collect them up and some of those questions will be asked during the 20-minute Q&A session at the end of the webinar. In terms of housekeeping, we are recording today's session and it will be available to attendees after the webinar. We also have resources that you'll see today during the webinar, and these will also be shared with you in a follow-up email, which you'll receive from YLab. All right, so to start the webinar, I would now like to introduce Professor Erin Wilson from the Centre for Social Impact at Swinburne. Welcome, Erin.
Thank you very much, Jenny. And if we could move the slide along, Josh, that would be great. Thank you. Lovely to see you all here today, and I know we probably all feel that we're just limping to the finish line, so I appreciate those who have made it to today's webinar. I know there is a huge interest in the topic of employment for people with disability in Australia and internationally. In Australia, as we all know, there are many initiatives at the moment and many areas of review to which we can all contribute. So I'm hoping that today's webinar will prompt and inform our thinking in that regard. So as Jenny said, the Centre for Social Impact at Swinburne has a strong interest in the area of increasing the employment equity for people with disability. And in that arena, we have been undertaking a range of work, some of which is displayed on the screen in front of you. So we've been focusing with a range of different partners. So one piece of work that we think is quite relevant to today is something that we did with our partners, Comcare and the Commonwealth Government, in which we developed a typology of employment supports. Now, what does that mean? It's really a way of mapping the wide range of employment supports that the literature tells us is useful for people with disability, well beyond the quite narrow focus that we tend to have in our employment support arena, particularly within Commonwealth labour market programs that tend to focus largely on training and on placement and job search. We've also done several pieces of work with our partner Inclusion Australia. The first was summarising the literature of the factors that affect employment for people with intellectual disability. And this goes to both the barriers of employment, but also the sorts of responses and strategies that we might implement and those that particularly have an evidence base. That work, the fostering employment for people with intellectual disability, the evidence to date is available on the Inclusion Australia website. So you can go there to look for that. Most recently, we've been doing work with Inclusion Australia and with others, including with the support of National Disability Services in enabling us to access some publicly available data that they hold. So this set of work is the Evidence for Reform series, where we've really tried to look at what is the evidence around the future of employment supports and programs and policy in the space for people with intellectual disability. That series will be available on APO shortly. And finally, the piece of work that I will shortly hand over to Perry to describe is the work around work integration social enterprises, and in particular, several models of that we've been building that relate to the organisational factors that are important in work integration social enterprises, including in our Australian disability enterprises, that are particularly important to foster both wellbeing, but also to foster the inclusion of people with disability. So I think on that note, I'll hand to Perry to talk about the work integration social enterprise ability model. Thanks, Perry.
Oh, fantastic. Thanks, Erin. And hi, everyone. As part of our information linkages and capacity building project, we did develop an organisational design model called the Work Integration Social Enterprise Ability Model. So just a bit of background on this one. We developed the model because we knew that employment rates for people with a disability have remained stagnant in Australia, and that people remain in Australian disability enterprises, or ADEs, for significant periods of time, and often do not move into open employment as they'd like to. The aim of the project was to adapt our original work integration social enterprise model in an Australian disability enterprise setting to support the training, wellbeing, and employment pathways of people with a disability. As you can see on this slide, the model includes subcategories with additional descriptions around structure, space and environment, culture, relationships, and you can see the other elements as you move around the circles in the diagram. There are elements that support individuals with a disability, for example, wraparound support, on-the-job learning opportunities, safe spaces, and the model includes elements that organisations require, for example, strong structure, good partnerships, and stable funding. So this model is housed within a social enterprise setting, but it also has a bridge to employment outside the social enterprise, and that's captured by the employment pathways element. But of course, things like training and the internal social enterprise culture play a big role in setting people up for success in open employment. Creating that employment pathway involves careful work. Things like discovering individuals' employment goals, customizing employment, and job carving each involve processes that can really help people feel confident and comfortable in a new job. But there are hoops to jump through and obstacles along the way sometimes. So if we flick over to the next slide there, we can see some of the barriers to employment on the right-hand side. And in this little list, we just cover over some of the challenges that we've found. And one of these is that while NDIS funding for employment is flexible and can be used in an Australian disability enterprise or open employment setting, it can be tricky to move back and forward between the ADE and open employment, especially if your level of NDIS funding changes. Essentially, the assessment of individual capacity doesn't always take into consideration the need for movement back and forward between an ADE setting and the open labour market, and how appropriate levels of support need to be set up with businesses in the open labour market. Questions around support and income can also mean that people feel that it is a risk to transition out of an ADE setting into the open labour market. Another challenge to the employment pathway is employer knowledge and confidence. And employers would like greater support in setting up appropriate work conditions for successful outcomes. So this means growing employer knowledge about disability and how on-the-job supports can be funded. So at this point, we're keen to understand more about how employment pathways in the open labour market can be carved out and supported, and how this is being done in other countries. And this is the point where I think we can learn from Rich and Sara today. So I'll hand over to Rich now for a little bit more of a discussion on how the policy, context and values shaping employment options for people within the US are at the moment.
Thank you, Perry. It's really my pleasure to be here, and I really thank the folks at Swinburne University of Technology for inviting me and Sara to join you. Listening to Perry talk just now, it sounds really familiar. All of the issues and barriers you discussed are the same kinds of things that we faced here in the US over many, many years. And I think I want to just warn you that please don't harbor any notions that we have all the answers in the US, but I do think we're moving in the right direction, and the needle is moving, and there are some specific activities that are making it do that. And so what I would like to do is kind of talk about 3 intersecting areas that kind of influence policy. If you could go to the next slide, please. Those areas are advocacy. In other words, people advocating for change in the policy and service system, people advocating for certain activities and points of view that encourage and enhance and promote the idea of people with disabilities being employed. So, and the advocacy has been longstanding, and I'm going to highlight 3 of those things here in this section. But I also want to say the other 2 intersecting areas along with advocacy are evolving practice strategies. In other words, what are the things that we know how to do that will result in employment and successful employment of people with disabilities? And so those strategies have been evolving, and we have some really strong methodologies that now make that possible. And then the third area is legislation that support current service environments. In other words, there's a longstanding service system in the US that is supported by various pieces of legislative activity and the attendant funding of that legislative activity. In order for the service system to change, a lot of the legislation also has to change. So, so we need to have expectations change, we need to have the service delivery and strategies change and improve, and we have to have supportive legislations that fund and support those changes. So let me first talk about the advocacy, because I think this is really what drives what we do, and it is helping us move in the right direction. And so these three things on this slide really are what I consider the key values that underpin contemporary disability employment policy in the US. The first, presumed employability. Now, this means what it says. In other words, we presume that anybody with any disability, with any degree of support needs, can work if they want to. In other words, there's a job for everyone who wants one, is what we like to say. Now, this doesn't mean that some people can become employed with disabilities. It doesn't mean that most people with disabilities can become employed. It means that every single person with a disability, irrespective of the type and level of support they might need, everybody can work who wants to work. And so this idea of presuming that everybody can work is what drives a lot of the current legislative activity that I'll describe in a minute. But that whole notion of presumed employability arose because of strong advocacy by people with disabilities and those people who represent them. And then it's also been driven by the fact that we now know more about how to make this happen than we used to. And so it is now realistic. It's not a pipe dream anymore. It's realistic to presume that anybody with any disability who wants to work can. The next kind of value that really drives a lot of this, and I'll explain this when I talk about some of the legislative activity, but the idea that people with disabilities should be both included in the mainstream of typical society and typical community activity, and they should also participate as citizens in that society. So the idea of full inclusion as opposed to exclusion, or as opposed to segregation into programs and services that are for people with disabilities only. But the idea that they should be included and spend their time with people without disabilities. They should be included in activities that everyone else in their community has access to and can participate in. And that they actually are not just passive people on the sidelines, but they're actually participating in those activities. Now, in the realm of employment, this means that the idea behind people moving into competitive integrated employment, as we call it, or in your equivalent would be something equivalent to open employment, but the idea that they are included in jobs in the community as opposed to being segregated in facilities or programs where they work with various tasks with only other workers with disabilities, and the only people without disabilities that they interact with are paid staff members. The idea of inclusion and participation is to eliminate that kind of a service and activity and fully include them in the world of work and in actual and authentic employment settings. And then finally, the whole idea of self-determination, which means that we, among other things, it should not be assumed that people with certain types of disabilities should be stereotyped into certain types of jobs. That rather than that, the types of employment they pursue and the types of employment they're able to obtain should be driven by what they want, what they think is important, what is consistent with their preferences, and that is consistent with what they have in themselves expressed the interest in doing and the desire to move in that direction. So a phrase that some of the advocates in the US have used for many years, and it applies here, is that nothing about us without us. In other words, don't do things on behalf of people with disabilities or to people with disabilities or for people with disabilities. Do it with people with disabilities. That they should be included, they should be contributing to their own futures and their own progress and activities, fully included. So in the world of work, what this means is that they are not stereotyped into jobs that we think they should do because they have a certain disability, but they seek employment. Their job search is driven by their preferences, their skills, their interests, and that the jobs they obtain or reflect those skills and interests and preferences. Now, a lot of people don't know what they want to do. A lot of people don't know what kind of work they can do. And so this is where a lot of our activity in the US has been about exposing them to work. In other words, exposure precedes interest. So it's amazing what people get interested in once they're exposed to it and have the opportunity to experience it themselves. And then they can determine what it is, in fact, they want to pursue. So presumed employability, the idea that everybody can work, the idea that everybody should be included and participate in the general society, and in this context, into integrated work situations where other people without disabilities are also working alongside of them, and that the work that they go after or pursue is driven by what they like, what they want, what their preferences are, and that's going to lead to the ideal situation. So these values, just keep this in mind, because as I talk about some of the service strategies that we now incorporate and some of the legislation, these underpin that. So if you can go to the next slide, please. So, we have been in the US, experiencing what we call aspirational movements. In other words, we have activities and movement that aspire to change things so that more and more people can become employed. It doesn't mean that this is something that happens or that we insist it happens. It's an aspiration of many advocates. And it isn't until it becomes legislation, it becomes something that people have to do, which I'll explain. But some of the things that we've aspired to do are through movements like things like what's called employment first. The idea that the first service strategy for adults with disabilities, it should be to pursue employment, as opposed to pursue some sort of recreational activity or some sort of segregated make work activity or some sort of congregate service where people with disabilities gather and hang out together. But rather the aspiration is that employment is the first thing on people's mind, and that's something that we should be helping them pursue. So throughout the United States, this means that various states have implemented activities and legislation that would encourage that, that endorse that. But most of the employment first initiatives throughout the United States have been, as I call them, aspirational, just that they aspire for that to be the thing, but it's not incorporated into any kind of legislative or service strategy yet. It's starting to happen, but for the most part, it's been something that people have pursued, and there's no real teeth to any of the states that have endorsed it and promoting it. But it's a nice framework to kind of organize our thinking about how we should pursue and help people with disabilities pursue employment. So another big aspirational movement within the US is the idea of helping organizations who provide primarily segregated kinds of services to transform themselves into organizations that primarily focus on helping people with disabilities achieve competitive integrated employment. And in the US, we define competitive integrated employment as employment where people are receiving at least the minimum wage, the federal minimum wage as compensation for the work they do, and that the people they work with and alongside of are primarily people without disabilities, so that they are fully integrated and receiving a wage and contributing to the operation of the employers who employ them. So that movement has been bolstered by a lot of federal initiatives to pay for organizations to receive technical assistance. Sara has been one of those people that's been helping a lot with that, as have I, and to be able to convert their organizations to a more competitive integrated employment focus. It's not required by any legislation yet, but it soon will be. But it's a way that those organizations who want to get on the train while it's starting to pull out of the station, this is the way they can help move their organizations forward. Another service strategy that has really promoted this whole movement and has really bolstered our ability to move the needle a little bit in the United States in terms of employment for all people with disabilities is a strategy called customized employment. I heard Perry mention it earlier in her presentation. The idea that a person can find a job that isn't necessarily part of a formal job description that an employer has, but that it's tasks that are matched to the individual skills, and they're tasks that the employer needs to have done in order to function at its maximum. So the idea that people can get jobs that are customized to their circumstance, the customization can be in the types of tasks they perform. It could be in the types of hours they work. It could be the circumstances under which they're supported to do that work. But in other words, it's customized for each individual. It's not one size fits all. It's a way of taking a concept, identifying a person, discovering what their interests and abilities and skills are and their preferences, and working with them to identify potential workplaces where they can apply those skills, where they can pursue those interests, and where, from the employer's perspective, they can contribute to the employer's enterprise. So more about that later, but I think that the explosion of customized employment in the U.S. has really changed the scene, so that individuals who weren't previously presumed to be employable because they were considered to have a disability that's too significant, or they were considered to have intense support needs that were very, very difficult to manage, there can be a job created along these lines. And so to make that happen, we have to teach people how to do that, which the professional development has really evolved in the US, so that there are many places and ways in which individuals who want to learn how to do this can be taught and can be supported and can be reinforced for being able to implement customized employment strategies and being able to help and support people with disabilities, regardless of that disability or the level of support they need, help them become employed. So the last thing I want to talk about is if you will go to the next slide, some key legislation supporting current service environment. So I'm going to abbreviate what this is all about for the sake of the time we have, but I want to point out some key areas that are really important to this whole movement. One is the Americans with Disabilities Act, which is actually not so new in the US. It was passed in 1991, but it prohibits the employers from discriminating against people because of their disability, and it prohibits anybody from preventing individuals with disabilities have access to whatever else is available in the community to everybody else. So using that act, some people who were in a nursing home with disabilities who wanted to live in the community sued the state because they wanted to live in an integrated community, and that was the Olmstead versus the LC, which is the what would you call it? The defendant in this case, a person by the name of Olmstead, successfully sued to be able to move from the nursing home to the community because the Americans with Disabilities Act was a foundation for that legal decision. So using that decision, a more recent lawsuit, Lane versus Brown in the state of Oregon, people in a sheltered workshop, or what you call, I think, your ABEs, sued the state because they wanted to have a regular job and they didn't want to be in a segregated disability-only service, and they successfully sued. And so the state of Oregon has completely transformed its service system so that all of the segregated, what we call sheltered workshops, are closing in the state, and people are finding jobs in the community. And the last report I read from the state of Oregon about their progress in that regard is that employment rate has basically skyrocketed for people who previously were served in sheltered workshops. And I know Sara and I and a bunch of our American colleagues were involved in helping with that decision, and also subsequently helping the state move in the direction to make the services more suitable for that kind of integrated employment. So that's the legal background. And there's many other states that are moving in the same direction. People are suing based on the Americans with Disabilities Act for access to the community. And then the last legislation I'll talk about in just a second is taking that in a whole other direction, whole additional direction. So the next big important piece of legislation I want to just touch on is called the Workforce Opportunities Innovation Act of 2014. This is a national, it's a federal system, very large system, which funds, among other things, the vocation, what we call vocational rehabilitation services, those services that are intended to support the development of employment of people with disabilities. Now, this legislation now codifies customized employment, meaning that this national federal agent service system can now pay for organizations and individuals who are skilled to support people to pursue customized employment, including discovery, which I see as part of your WISE scheme that Perry talked about. But discovery is basically a way of helping people learn about themselves so they can be self-determined and choose the kind of jobs they want to pursue. It also, this legislation also requires that 25% of all of these funds be allocated for services for transitioning youth. In other words, youth who are still in high school, who have disabilities. Fully a quarter of the funds that are available are now allocated for that purpose, so that youth with disabilities can get a head start in their adult employment. Because guess what? The research we've done and the research lots of other people have done in the US has shown that if people have jobs in high school, have work experience in high school before they exit school, regardless of their disability, regardless of the kinds of education they receive, kinds of special education services they receive, if they're exposed to work and have actual jobs before they leave school, they're 5 times more likely to be employed as adults. So this is considered now money to be well spent. This is a big deal because previously in the US, vocational rehabilitation services did not pay for anything that for high school students because they thought it was the school's responsibility to do this, and basically said when they're out of school, then they can come see us. But we've learned that if they can get involved early and the youth can have job experiences, they're going to become employed. So a big deal in the kinds of service delivery that people with disabilities are now receiving in the United States that they weren't receiving just a few years ago. And finally, in the context of today's discussion, there is what was now under consideration, an act called the Transformation to Competitive Integrated Employment Act, which would essentially abolish the use of sub-minimum wage in the US. Currently in the US, people with disabilities can be paid less than the minimum wage, especially those individuals who are doing piecework or whatever kind of work in a sheltered setting. There are also people who work in the community who are paid less than minimum wage, and this act will abolish that practice, and that everybody will have to get a job that pays them at least minimum wage. Now, the beauty of customized employment is that you can find tasks that people can do at a community's employment places of work that are worth whatever they're getting paid for. So they don't have to be paid less than minimum wage. And so this is a big deal. It's pending. It's not been passed yet, but all indications are that it will. So my last slide, if you go to the next one, please. Yeah, so the Office of Disability Employment Policy in the federal US Department of Labor has been supporting all the initiatives that I just talked about and promoting them. And they've developed recently, with the help of several national service provider organization, national organizations. Let me say that again. National organizations who represent all of the service providers in the US. There's several of them involved in this initiative, and they helped the Office of Disability Employment Policy come up with a national plan to help increase competitive integrated employment. So among the key recommendations in that report, which I think at the end you'll have a link to that report so you can read it in detail. But key things that everybody seems to think needs to happen, and that these are the things that the government and the legislation need to support. And these are the things that need to be done in the field to make more competitive integrated employment happen. First of all, professional development. People have to learn new ways of doing the work that they now do, or new people have to learn how to do it so they do it correctly. But there needs to be a system of support to teach people how to do these important activities. These things don't happen in the vacuum, and you don't learn about it just by being thrown to the lion's den, so to speak, and expected to do it. You have to be taught the proper way to do it and the most effective way to do it. And so local service providers, those people at the local levels need to be supported to be able to make the changes they need, to be able to provide more competitive integrated employment type of activities and services. Employers need to be engaged. This is the whole thing. I know Sara will talk a little bit about this, but you know, there's only 3 reasons why employers will hire anybody, whether they have a disability or not. The people that they hire should either help them make more money, help them save money, or help them operate more smoothly, or all 3 of those things. So to promote the employment of people with disabilities among employers is really, I think, a fool's errand. Employers need to be engaged in a more business-oriented approach so that employers see that what we're helping promote is individuals who will help their operations either make money, save money, or operate more smoothly. So employers need to be engaged in a better way, and people have to be taught how to do this. Another important thing is families need to be engaged, because families are very important in all of this, because they're the ones who can either promote or not promote presumed employability among their family members with disabilities. So again, they have to be taught and exposed to some of these ideas so they're comfortable with them, and so that they can also provide input into how to make this work on behalf of those individuals and their families and other families. I already mentioned school to work transition, the whole idea that wouldn't it be great if the culmination of public education for all people with disabilities was a job? The fact is, we really do know how to do this now. And so how to promote that is another important way, how to get schools to work together with adult service providers, and how to make sure that funding helps expose youth to those work experiences as I described previously. And then finally, new resources, the new ways of paying for these things need to be considered. We need to further advocacy with the government entities that fund these services to show them how they might reallocate their resources in more effective ways to promote all the things that I just talked about. So I'll stop there, because my colleague, Sara Murphy, who I've worked with for many years and who's one of the best in the US at this, will talk a little bit about how this happens on the ground and what are some of the considerations to make it happen at the local level and at the ground level. So Sara, over to you.
Okay, thank you very much, Rich. I'm really glad to be here as well. I have been charged with kind of looking at how to take these aspirational movements and looking at how we are operationalizing them across 50 states in the US. So I'm going to try and talk globally about the really great things that are happening in some states that are really moving the needle. The second you cross the state line, things get different. So it's a little hard. And I also wanted to make sure that what we talk about will be useful in Australia. So I'm going to kind of, with a broad brush, kind of lay out, where to start with getting from policy to practice, and some of the things that we've done to break down silos and barriers, and some of the brilliant ideas we've come up with to kind of operationalize our new laws and our new principles. So next slide, Lucinda. Some of these include, the government, as Rich said, the Olmstead Act and the Americans with Disabilities legislation has been just instrumental in really kind of setting things up for us to really move from institutional settings and segregated settings into the real world. And a lot of the stuff that has been coming down the pike at the state level and even at the federal level is kind of these carrots and sticks is what we are looking at, and they're trying to move the people forward with kind of policies incentives, rate incentives, and some other things. But it really is difficult. And I wanted to talk a little bit about making change for a second. If you concentrate on just carrots and sticks, it's not a good technique and it's not a good move. Not a good way. If you're using carrots or incentives like better rates for placing people, or sticks such as shutting the front door or sunsetting the minimum wage. Sub-minimum wage rate. Those are things that get people's ire up and get them angry, and they tend to just spend all of their time arguing instead of really looking at the beauty of what the laws is suggesting and coming up with ways to really move around it. And with carrots, they tend to focus on the carrot, just how can I get the carrot, how can I get the money, versus focusing on the reason behind it or the outcome that we're really looking for. So next slide, please. So what I wanted to do was to really look at the change mindset that we are dealing with in the United States right now, from getting from these kind of aspirational ideas into actual practice. And those laws are laws that have kind of given us this hope that people with disabilities can be active participants in our communities and in our workforce. So that hope has been set. And what we're really looking at is, how can we make that change to really move them forward? And providers at the systems level, at the state levels, and at the federal, state, and local levels, and individuals themselves and their families are all thinking that this is a wonderful thing, and we all start to try and work through how to make changes in our own little fiefdom. And what we find is that we fail, and that we start to we start to do things and it's difficult and it's not working, and there's all sorts of things that are barriers that are in the way of making this change that we're so hopeful to make, and we start to really question. Is this the right thing? And the naysayers, the people who have always been there saying, I told you this won't work, start saying, see, I told you so. So it's this whole thing where you're sliding down that and what we find is that many people get stuck down at that bottom of the curve. And what is needed there is really insight and learning, and really, kind of realizing that change includes failure and learning, and that we really have to look at learning from our mistakes, and learning what needs to change, and then really addressing that. So that insight and learning is the key to really making significant change, and really starting to get your sea legs, so to speak, and trying, getting off the ground with making things happen, and actually seeing our employment rates go up, and seeing people go to work successfully. And we start to gain confidence, and we start to really see that this does work, and we were right. So it's a really interesting model, and I think it really helps to kind of acknowledge that, that change includes failure. So next. Oh, and the carrots and the sticks, I guess there was some animation. Yeah, so never mind. Yeah, just moving with carrots and sticks. You do have to kind of use carrots and sticks to get people out of the gate. So oftentimes, people will just stay where they are unless you do poke them a little bit. So the laws and the legislation is a great way, and also the Department of Justice stepping in and saying we mean it is a really good thing. So competitive integrative employment, kind of what have we learned? Obviously this is what's working, what's moving the needle in the United States. Again, there's 50 states. Some of the states, the needle's not moving. In other states, it certainly is. So, what are we doing to kind of shape the path? What are we doing to get the snowball kind of rolling down the hill? And how are we moving from, getting from policy to practice? So next slide, please. So the first step, again, in that change mindset is to really, instill hope and gain buy-in. And here's where we have to look at advocating for this change at all levels. And Rich had talked about, that advocacy that was so important. And we have a number of organizations in the United States, APSI, TASH, People First. There are some employment first movements that are across states that are really taking an active role in pushing the envelope and really looking at, getting real work for real pay, and really looking at, people's ideas about, what services should look like for people with disabilities, and really giving people with disabilities the microphone and having them talk about, what they want, and that self-determination is really an important piece. So the advocate for change, and it's at all levels, that with our national organizations, they have spearheaded the fight to eliminate subminimum wage. They are spearheading the roll-up of customized employment and all of the things that we know really do help. So they're really promoting that promising practice, and then also kind of demonstrating, grabbing those successes and showing the outcomes that people are getting, and that this really does work, and people are starting to really gain confidence in the models and gain confidence in the ideas. So it's really, the buy-in is starting to really percolate through all levels. So at the system level, the state agencies are starting to see that this is working and that we have common goals and common clients, so to speak. So we should be working together and using our resources, pooling our resources. And how do we do that? So another thing that we see is that people are starting to start early and really looking at that school to work and work-based learning as being one of the first and foremost for getting people with disabilities into employment, is to really start young and to really make sure that they have employability training throughout high school and even before, and that family engagement really starts early, and that expectation of employment is there from day one, and community inclusion and independence, and a meaningful life. And what does that look like? So we are learning more and more about how to engage with families and how to have them an active partner throughout and it's really improved outcomes. It's really improved, the where people are getting to, and the independence, the level of independence that we're seeing both in work and non-work situations. The other thing that we're doing is really seeing that, or it's something that really does contribute, is to kind of encourage employment through service planning and case management, which is kind of where the person is kind of entering the system or applying for services, is having those service coordinators and case managers really stress the idea of employment being employment first, and an important piece of a meaningful life, and in fact a foundation for having a meaningful life, and having them really understand that. So it's really, really important. And another thing, which I'm not going to spend a lot of time with because it's a huge bumbling barrier in the United States, because we have a benefits situation that is kind of lumpy when it comes to going back to work, but I'm not going to talk too much about that. Next slide, please. So instilling hope and gaining buy-in is the first step. And then the next piece next slide, please, that we're really looking at is how do we make sure that we're really shaping the path and making sure that it's easy for people to do the right thing, and less easy for them to do what they've always done. So really planting those flags with legislation and policy and advocacy, and really pushing forward with those things is really important. The other big piece was, as Rich mentioned, was kind of clarifying and codifying what we mean unify all of these things and making sure that we're speaking the same language. There's a number of agencies and state agencies and who are involved in serving people with disabilities. So we're making sure that everybody understands each other's missions, everybody understands the definitions, who's responsible for what, and then reallocating and looking how we can fund and incentivize integrated employment outcomes. And that's really looking at redefining what the services are that we want and funding those that are contributing and disincentivizing those that are getting in the way or that are doing things the way we used to do things. So really reallocating funding. We're looking at sequencing and braiding of funding. We're looking at making sure that instead of giving a service provider a block rate for the day, we're giving them hourly rates for an hour of service so that we can break up that day and people can go to work and have non-work services in the same day. We're also looking at sequencing services. So, going from one state agency to the other as a person moves through the path of employment. So really looking at funding, and we'll talk a little bit about that. Another big piece of making sure of what we're doing is really collecting and analyzing our data, because it's really hard to improve something if you don't have a measure. So what we found is many states didn't collect information on employment numbers for people with disabilities, or didn't have good numbers. So one of the things that states are really looking at is how can we make sure that we have a baseline. So many states are now really looking at collecting this data, who collects it, and then what they're doing with it to promote planning and forward movement. So next slide, please. So another big piece of this is to build the capacity of supported employment outcomes. And this is happening at both the systems level, at the state side, and then at the local level and the regional level and the local level for states. So what we're seeing is a huge shift into interagency collaboration. And again, really clarifying, what our mission is at our agency and why we were developed, and what your mission is, and how do those missions coalesce, and how can we work together, and how can we streamline our efforts. So we're really, one of the things that we were seeing is that the federal government took a huge role in this in the beginning. The Office of Disability Employment Policy through the Department of Labor really spearheaded some great initiatives where they one was what they referred to as their EFS-LMP, the Employment First State Leadership Mentoring Program. It's a lot of acronyms, but they were getting states together and they were saying, okay, we want education in the room, we want your work services in the room, we want your developmental disability services or mental health services in the room. We want all of the people that are working with this population to be here together and to crosswalk their eligibility and to make sure that they're streamlining their services and that there's not duplication happening, so that we can make good use of resources and we can create a pathway for people. And so there were these beautiful blueprints drawn up by these organizations in a couple states that have really been instrumental in helping with employment first. So the other thing that we're looking at is really leveraging our existing resources and making better use of them. So we are now looking at how can we best use all of the dollars, each and every one. And there's a huge push at the local level to really use our day habilitation, our day services. It used to be all about taking people out and having fun and doing, kind of social recreational things. Not anymore. People are now looking at these services as a way to really build confidence and independence in communities, and to utilize these services to really connect individuals to the world, to help them build friendships, but also to help them strengthen their employability through volunteering and internships and other situations. And then, pairing that with an employment service and braiding in an employment service that can then help them to find a job and get a job, so that they have a meaningful life, both that in work and non-work elements. So it's really pretty interesting. We're also looking at streamlining, like I said, the eligibility and the enrollment across one and another. So if you are eligible for one system and it requires you to have a disability, you don't have to prove you have a disability to get services from another system. So it's really been great. They've been able to really kind of crosswalk those eligibilities. So if you're eligible for one, you're automatically eligible for the other. And they've also come up with great definitions and ways to share the ride, so to speak, and make what we refer to as stone soup. Everybody throws a little bit in, and it's really been pretty amazing to see the outcomes. The other thing that we've seen in the states that have really made significant progress, Rich talked about Oregon being one, that of course was the result of a lawsuit, but there are other ones who have taken their employment first policies that their state have passed and put a little money behind them, and they've created offices and employment first offices within their state, which are kind of geared to working around advocacy, collecting and analyzing the data. Like I said, they're also engaging with people around employment first, and then also working on that service transformation, that insight and learning that has to happen at the local level and at the provider level. So these technical assistance centers are playing a very, very instrumental role in kind of moving things forward and creating these learning collaboratives where we can kind of learn instead of having people reinventing the wheel everywhere. We are learning very quickly, kind of exponentially at this point. So these employment first offices in Colorado and Ohio, they have some really good ones. And then also some, the lead center at the federal level is another one. We've given you some resources on a resource sheet and you can look and see. But yeah, really, really interesting and really taking things further. So next slide, please. It gets, after kind of looking at, Rich mentioned, the server, the support provider level transformation is a huge thing, because obviously this is where the rubber meets the road. This is where the services are provided, and what we're finding is we're asking people who are who have kind of one foot on the dock and one foot in the boat, and it's a very difficult situation, and a lot of them are so used to being on the dock that they don't really know how to row a boat, so it's really kind of a difficult situation. So we are finding that it really does help to have to give a little bit of extra money. So many states are giving these service transformation grants. Federally, there's a few grants coming down the pike to help with this kind of transformation work, and then really helping them to evaluate, where their bright spots are, where their resources are, and then to utilize those to transition into providing community-based competitive integrated employment services versus their site-based stuff, and many of them are looking at how to what to do with their current sites and things, and it's really a huge transformation. But we are finding some ways. We are really starting to see services let go of their facilities and to really embrace the idea of person-centered, tailored services and self-determination and all of those things. There's statewide community of practices and learning collaboratives. There's been a lot of effort around rewriting waivers and funding mechanisms. Our waiver is kind of our a federal agency, CMS, Center for Medicaid Services, ran our state hospital So the people who ran institutions, huge pot of money. And when we started to, people sued to get out of those, and they started closing those down because people did not want those anymore, and students were going to school in regular schools, and people were not being institutionalized anymore. They took that money and they created these waivers to keep people in the community. And these waivers are what states use. They pull down this money and match it with state funds. And it's how they fund a lot of the pre-vocational work and also the day habilitation work. And the CMS has recently come out with a settings rule that is going to sunset the idea of using that money in a segregated setting. It's called the settings rule, and they are no longer going to allow states to use that money in segregated settings. So no more sheltered workshop pre-vocational training, no more day habilitation training in segregated sites. And they are to use that money to connect people to their community and give them access to participating in community life and employment in the community. And it's just been beautiful, because it was the final straw. I think that's going to break the back of our sheltered workshop setting, because it was how these sites funded their methods. So the sub-minimum wage was what they paid people, but they did not call these people employees. They called them trainees. And then they were billing for providing vocational training to them as well. And both of those things have been taken off the table, so to speak, or will be, hopefully. So that is going to close the front door of a lot of those centers, and will be an impetus for those programs to let go of that and to move on. So the other thing that we're seeing again is that kind of repurposing those day services to really build confidence and abilities in the community, so that we can then, people are confident about being on a bus and going to work, and then also doing volunteering and internships through those. The other thing that we're looking at is provider accountability and really counting how many community employment placements did you make this year. And one of the beautiful things that I've seen is the state of New Hampshire publishes these numbers. And what they found is it's really moved the needle, because can you imagine, you're the program at the bottom of the list, and everybody else is making more placements than you, and it's out there for all to see. So a lot of these programs have said, we cannot be the bottom of the list. And they're actually going, again, that insight and learning, they're going to their peers and saying, what are you doing? And how are you doing this? And what do we need to change? So it's really done a lot of things. So next slide, please. One of the things that this next slide shows is one of the projects at the local level for service transformation. And this is Wisconsin's Building Full Lives project. And you can see there's a number of elements to it. So that collaboration, that insight and learning from each other, they every year it was a grant application. 5 organizations were selected, 5 providers to join the collaborative. And over 5 years, they've done this. So now they now have 125, I think, is what they're up to. Participants in their Employment First or their Building Full Lives project. And it's really been a great opportunity for people to look at service transformation stuff, to really participate in training from subject matter experts from across the country, and to really work with their local funders and stakeholders to evaluate how can we eliminate the barriers that we're finding, how can we promote better rate settings, and things that are going to really help us, that are going to support community employment. So next slide, please. I'm running out of time. And the last piece, again, that Rich had mentioned was employer engagement. And this is key. As he said, disability is a social issue. It is not something we can tout and we can get employers to hire people with disabilities. That's not what they're in the business of doing. So we really have to look at how do we message this correctly and market this from an employer's perspective and from a demand side. And that really is helping them to understand how hiring an individual, each individual will benefit their job in some really obvious, and really helping them to understand how this person can support, making their product faster, making their, solving an issue, or really helping their bottom line. So that is a key element, and we're starting to really understand that. We are also starting to professionalize our employment services, really hiring people who know about business versus hiring people who know about disability. We are starting to really look at, do you know about, business principles, process improvement, lean strategies, or Six Sigma? That's what we're looking for now. The disability side doesn't matter, because what we're really looking at is someone's strengths and what, figuring out how they can benefit a business and what that unmet need is, and how do we partner with businesses successfully for that person. And again, that is customized employment, and it is really changing the way that we are doing this. And it really is a way to partner with employers to identify their needs and then address that, because you've targeted that business based on what the candidate can bring and what their strengths are. So it's really a win-win approach. I can't say enough about it. And it really does work. So with that, I guess I am out of time. It has been just a really wild ride in the United States, and it's really been kind of fun to watch, and it's to see things go from advocacy to people kind of figuring it out and saying, look at this is really working, and it's really been inspirational. So it's been kind of an interesting time to be involved in this field. So happy to be here and happy to share. With that, I think I'm done.
Thank you, Sara, and thank you, Rich, for such a comprehensive presentation, but also, really touched on some of the issues that we're experiencing in Australia around getting that needle to shift. So I think that was it was really helpful to hear the strategies that you're using, and I think in Australia we now need to look at how some of those strategies can start to be embedded within our own systems, which are obviously very different to the United States systems, but at the end of the day, the strategies that work, they work regardless of the system that they're operating in. We need to get that system level, those system level settings right to allow that good practice to flourish. So we do have a few questions. So we're bringing all the panel back, Lucinda. Yep. Okay. So the first question, and this is a good question to ask, is tell us a little bit about the needle moving. You talked about the needle moving, and I do like that expression. How far has it moved?
Yeah, so that's a good question, and I wouldn't say that it's moved so significantly that we're going to brag about it to everybody. But I'll use Oregon as an example, because that's they're the furthest ahead of everybody, transforming their services to an employment-only environment. And every single one of their service providers in that state have increased employment of the people they serve. And I don't know the percentage of increase, and I'm not sure it would be really relevant to, it would be possible to say what percentage increase, because we don't know how many people weren't working before and all that. But I can tell you that way more people are working than used to be working, and that the state of Oregon has actually issued a report on that, and perhaps we can get you the link for that so that people can see what that says. But
that would be great. But it's interesting also that you talked about at the system level, at the service delivery level, all of the organisations, and I do like your language, that serve people with disabilities, have all shifted their thinking by the sounds of it.
Yes, and they've been
in
forced
Oregon.
to. The court made them do it, but they're doing it.
Yeah.
But so that's just one example. I can't give you national employment figures. I can tell you anecdotally, everywhere I go, though, there's more employment reported than before. So
right. And this is one of the reasons that through Employment First, one of the reasons that they're looking at data as being very important and making sure that we are able to, it's going to be apples to apples when we start going across state lines and stuff. And right now, many of the states aren't collecting that data or weren't collecting the right data. So it's been really difficult to say just how far the needle's moved, but there are some just banner states that you're seeing amazing outcomes. And then there's others, Alabama is at 5% employment, and it's just horrific. The services down there are so different. So it really, as soon as you cross the state line, things are apples to oranges.
Yeah. Okay. Thanks for that. Another question that I think I might open up also to Erin and Perry is that you talked a lot about collaboration as being a really critical factor in the successes, and also the sharing of information through, what works through communities of practice and so forth. And so in Australia, we now have a competitive market, a service provision market, which goes into employment services as well. How do you see that collaborative approach and that sharing of information happening across competitors? Have you seen that in the US, or is it a different system? I might go to Sara first, or Rich first, and then go to Erin.
I'm not sure I understand the question. So are you talking about the provider level, or are you talking about the agency?
At the provider level, we have a competitive marketplace now under the NDIS. So all the organisations are technically competing against each other for, to win.
I think it's a lot of the training and technical assistance is coming down from, their national SMEs that are doing it. So, I think that is going to be what's going to make that not an issue. But it is what we're seeing, the collaboration in like that Wisconsin project. The people are really interested in, there's plenty of people out there to place. There's such a backlog of people who want to go to work. So I don't think finding clients is going to be a hard thing to do. So I think that, people right now are trying to really do what's right and to really change how they're doing services. So people are gladly sharing ideas and working together to eliminate barriers, because it's going to certainly make it easier for them as well. So like I said, I think we've hit a nice crescendo into like figuring things out, and we're starting to really, people are asking not to reinvent the wheel and asking people to really, put stuff out. So
okay, excellent. And Erin, Erin, did you have a comment?
Yeah, I think it's a really interesting reflection. Our system is, in that sense, quite different. I know in the information linkages and capacity building space, which did to some extent fill the same role as you talked about in America, where there was some transformation grants to some extent, or innovation grants provided into the sector. And there was certainly a demand for wanting to do more collaboration and more knowledge sharing, but no resource to do so. So that wasn't funded as part of that. And that was certainly something that we've established through the research around that program. And a missing gap is the joining the dots and the collaboration to be resourced. But in the market side, I think we have an opportunity in that we actually have a very poorly developed market of specialised employment service providers in this space. We've got the labour market funded, labour market providers funded at the Commonwealth level. So in our state, in our area, that's the Disability Employment Services. They've been around for a long time, but they do a certain function. Beyond that, we don't really have a very well developed market of employment support providers, which is in some ways a problem, but in some ways an opportunity, because it might mean, do we have the potential now to decide to all collaborate together rather than to set it up as a competitive marketplace where we try to lock down intellectual property around certain types of employment supports. So it's an opportunity to be interested if you had any other reflections around that.
And I think the point that you made, Sarah, about the information coming from the federal level down means that it was available to all providers rather than certain ones. But it sounded also like you had some community of practices operating. I think you mentioned Oregon as a state where the bottom ones were reaching out to the better performers. And I think in Australia we really need to build that culture of reaching out to other providers rather than perhaps being seen as competitors.
Right. And that Wisconsin project, Building Full Lives in Wisconsin, is a great learning collaborative. And they were, everybody, it was this state together, we're going to do this. And they would bring the whole learning collaborative together once a year for training. And the people who have been in it for 3 or 4 years were able to show their outcomes and show what they did and show the transformation and so they were 3 steps ahead of the newbies. And it really made it easy for people to and they would go visit each other. They would, it was really a wonderful collaborative and a wonderful project, and really had a big impact on the numbers in Wisconsin.
Yeah, excellent. Somebody's asked a question, which I think is interesting as well, about the role of families. So, of course, in Australia, we've shifted to the NDIA, the market-based funding system. And so for people with particularly intellectual disabilities, families have become a really critical part of that system in terms of advocating for funding and then doing the service coordination role in a lot of cases. So how does that work in the United States in terms of building families as a key ally for young people? What's worked well in that space?
Yeah, so that's a great question, because families can both be an inhibitor to advancing this notion, and they can also be a promoter of it, depending on their perspective. And many parents are thinking, we want our sons or daughters protected. We don't want them to be exposed to any kind of risk. So we like where they are. And there are other parents who say, man, this is the greatest thing in the world to see my child succeed at work. So one of the strategies that has helped along those lines that you ask about is that the success stories, the parents who become promoters of this idea, to talk to other parents about what it's meant for them. And parent to parent is really the most effective way that this can be communicated.
Great. And so that you've seen that built into the systems in the United States, that those opportunities for parent to parent.
Well, It's not built into the system per se. No, it's not. But since everything's moving in that direction, and the legislation is promoting it, and there's both, as Sarah said, carrots and sticks to make them do it and to help them do it. Parents need to know what the heck this means for me and for my son and daughter. So other parents, they seek out other parents, and good service providers have also made the point of making parents available to each other so that they can speak. There's no formal funding for that. There's no formal program for that. It happens kind of at the local level, kind of anecdotally.
Yeah. Okay. One successful method that we've seen in California, we have a self-determination budget that people are handed their bucket of money and said, and where the families are then expected to kind of spearhead the development of the plan and everything. And some parents are better equipped to do that and have the wherewithal and the ability to spend more time on that, and other parents don't. And in California, one of the things that they've offered with self-determination is a guiding service, a person who can go into the family and help do some discovery types of work with them and help them to kind of look at what does a good life look like, what is missing, what are the services that we want to use this money for, so that they're not just, kind of paying a cousin to babysit the person, or something like that. And then they can, that guiding person and helps them to find the resources, be it with a provider agency or with a public resource. So it's really helped families to utilize those self-determination monies.
Okay, excellent. And so, Erin, do you have a comment on that in terms of how the LACs or the service coordinators in the Australian system might be able to take on a similar role?
Sorry, Jenny, I was actually just thinking about another question that somebody else had chatted about. But I think that whole conversation that Sara and Rich have been talking about certainly does talk to the centrality of what we have funded, I guess, in terms of LACs, support coordination, and case managers to some extent in other disability funded systems like, workers' compensation and injury, for instance. So those are absolutely central roles in relation to this notion of employment first and the employability of people. And I know that there's been some work from the NDIS, obviously, to try and get employment into people's plans to a higher rate, et cetera, that whilst the goals might be in people's plans, we can see in some of the data that it's not shifting the data that much in relation to employment, particularly for some groups like people with intellectual disability. So I think, we still haven't really cracked it with those key roles in understanding that everyone can work. So I think they're understanding that some people can work, but there are others that we are sending into other directions. So more work to be done there.
Okay, excellent. Thanks, Erin. There's also a question about how the strategies and initiatives you've been involved in have shifted workplace culture. So I know, Rich, you talked a bit before, and I think you did as well, Sara, about how critical customised employment is as an employer engagement strategy. So can you talk a little bit about how that has worked to shift culture and build social inclusion for people within workplaces from your experience?
Yeah, so one way to help people become included in the workplace is to find them a job where they're actually contributing, and that creates a level of acceptance. Now, as we both talked about, there are strategies for engaging employers, and they're not trying to convince employers to hire people with disabilities. They're trying to help employers understand how this particular candidate is going to benefit the operation of that company or that employer. So this is something we're still fighting in the US. We still have a thing called Disability Employment Awareness Month, where we're trying to get employers to consider hiring people with disabilities. And it still, in many cases, seem to be kind of more of a plea to employers to consider people with disabilities, as opposed to, here's an individual who can help your individual company in these specific ways. And so training people how to do that is one of the keys to making customized employment work. We've had lots and lots of people working in jobs where they're only doing 2 or 3 tasks out of a huge number of tasks that a position might have, but those tasks are making things work better for the employer. So that's how customized employment benefits the employer.
Yeah. Okay. Excellent. We've probably got time for one more question, and I think this is a good one that's just come in. Reflecting back on all of the work you've done, what do you think Australian service providers should be thinking about in terms of transitioning away from segregated settings to integrated settings? We're sort of at the start of this process. What are some of the lessons you've learned, or some of the mistakes that have been made that you think could be learned from in the Australian context?
Well, Sara, you can.
There's a lot of mistakes.
You can embellish on this.
Whole second webinar maybe of mistakes.
Yeah.
It does not happen overnight, for one thing. But it really requires shifting everybody's way of thinking, what your goals and expectations are. People have to be trained how to do it. The funding has to be organized in such a way that it funds. I mean, you don't want the organizations to cease operating financially because they're not getting the right money to do the right thing. So in many cases, it's been teaching providers how to characterize their services to their funders so that they still get paid for what they're doing, but it's a different thing they're doing. That's a short answer. There's really a lot of complicated aspects to this. And
I think you said recently the time frame for shifting from segregated to integrated settings, it had been about a 10-year time frame. Was that right, Sara?
Yeah, no, and I think one of the things that's really changed people's perspective is this meaningful day, hybrid service or braided service where there's non-work and work services, because parents many times were like, my kid is not going to work a 40-hour week, and what's he going to do the rest of the time? Or what am I going to do while you look for a job for him? Or what happens if he loses his job? Then he's back home, and so having the ability to have that non-work side where it's really about teaching skill building, and then also making community connections and helping people with non-work social aspects and social competencies and confidence in the community for people who are reticent or scared of going to work. Or if someone loses their job, we can pick them up, brush them off, and say what happened there, and get them back in the saddle and get them back into employment. So that's really changed things for families and for individuals. It's a wraparound service. It's really very comprehensive. And it really gets at, the kind of, I have a great job, but I'm still socially isolated. I don't have my friends anymore. I don't go out. And people with intellectual and developmental disabilities oftentimes don't initiate that other stuff. So we're able to teach them how to be a good friend, and how to call up your friends, and how to go out and do things with your new money and your paycheck. And so it's really a great way to really focus on the whole person and to address those things. And families really find it comforting that they know that if the person does lose their job, it's not the end of the world, that we're going to get them, and they're still connected with us, and we're going to, do some stopgap things until we can get them back into a regular job again.
Great, thank you. And I think in the context of the NDIS in Australia and the individualised nature of funding, certainly our systems potentially do allow, for that blended and braided approach that you just talked about. Yeah. All right, well, unfortunately, we're out of time. I'm sure we could have kept going with more questions, but we are out of time, so we will wrap up there. So firstly, I'd like to thank everybody for attending today. You will receive some follow-up information about the webinar, the recording, and some resources. Particularly, of course, I'd like to thank our two presenters, Rich Luecking and Sara Murphy, who have actually dialed in tonight from the US. So it's late afternoon and early evening over there where Rich and Sara have come from, but we really appreciate you taking the time to engage in the webinar. And just to let you know, Peter Simons, I believe, is on the line, and thank you to Peter for connecting us up with Sara in the first place. And I understand that Sara will be visiting Australia early next year. So
there may be some... Can I give a shout out to Peter too?
Yeah.
Peter, good to hear that you're with us.
Yeah, so hopefully when Sara comes to Australia next year, there'll be opportunities for further engagement, with her while she's in the country, which I'll leave to Peter to let people know about. As we said, the project resources and links will be made available early next week. YLab will send those out to you. And we also have a Design for Wellbeing webpage. So Perry manages that website, and she's happy to speak to anybody about the work integration social enterprise model that she spoke about earlier. So please reach out to Perry. Finally, I'd like to thank the people who, of course, made the webinar happen. So thank you to YLab for facilitating the webinar today, to Green Fox, who do a lot of our design work. The project team includes Professor Robin Eversole, Dr. Andrew Joyce, and also Associate Professor Luke Howie. So thank you to those people. And also to Jessamy G, who drew the picture that you saw earlier in the webinar. And finally, thank you to our interpreters, Kim and Karen, and also to the captioner, Amy, for their work today. So thank you very much, and we hope that this is a start of engaging with you about how we can shift the needle in Australia the same way that that we're starting to see in the United States. So we hope to engage with you again soon. Thank you.
Thank you, everyone.